Some 7 million Americans have had some kind of stroke in their lifetime, and what we're looking at is imaging studies suggesting that a large number of these have had asymptomatic infarcts. So we're talking about a study that is appearing in JACC Imaging. It just appeared. It's the March issue, and it's left atrial volumes and reservoir function associated with subclinical cerebrovascular disease, and we're going to talk about the CABL study. And I'm with Cesare Russo, MD, Associate Research Scientist, Columbia University Medical Center in New York. Okay, this is, the CABL study actually comes from a larger trial. Tell me about the parent study.
Okay, the CABL study is a sub-study of the NOMAS study, which is a large prospective study carried out in a population living in northern Manhattan. And the aims of the studies are to investigate risk factors and incidence of stroke in a multi-ethnic community. Now, the CABL study is aimed at assessing the cardiovascular predictors of subclinical brain disease, which includes silent brain infarcts and white matter hyperintensities. Right. So this is an important topic. As you said, a lot of people, the burden of stroke in community is huge, but the burden of subclinical brain disease is even bigger. They are associated with a much higher risk of in the future incidence of clinical stroke and cognitive decline and dementia. And population studies, including ours, found that in normal people over 50 years of age, the prevalence of silent brain infarcts can go up to 30%. So it's like a very large portion of normal people living out there. So our study aims at identify some markers that could re-stratify the risk of subjects, possibly identifying people at higher risk of subclinical brain disease.
And what did you find when you started to look at these markers?
Well, the study that you mentioned that's coming out on JACC is, we looked at a left atrium volume, which is a very well-known marker of stroke. But so far, nobody had looked at its association with subclinical brain disease. So we're using a three-dimensional echocardiography, which is the best technique possible to measure LA volume. We looked at the LA volume during the whole cardiac cycle, and we measured the volume in different parts of the cycle, measuring the minimum, the maximum volume, and the reservoir function. And for the first time, we documented the association, a strong association with LA volumes and function with silent brain infarcts.
So what's the clinical message you'd like to get across?
Well, there are two messages. The first is general, like we know that an increased LA volume is associated with subclinical brain disease and with clinical stroke. So when we find people with enlarged left atriums, we have to look for other risk factors and treat them more aggressively. The other message is more technical. We found basically that the minimum volume of the atrium, which is the volume measured at end diastole, is a better predictor of silent brain disease than the maximum volume, which is the one that everybody in the medical community measures. So we say that it's probably time for a paradigm shift, and let's start measuring the minimum volume instead of the maximum volume.
Terrific. And are you going to be doing more analyses with this original group of patients?
Yes, we are in the middle of a new analysis at the ACC in 2013. I'm presenting a new study that for the first time demonstrates that a subclinical systolic dysfunction of the left ventricle measured by spectral tracking strain is associated with silent brain infarct. So we are going forward in identifying echocardiographic markers of silent brain disease.
Terrific. Thank you very much. And this is in the March JACC Imaging. Please look there for the paper. And please look in CardioSource World News for a variety of summaries from what we call JACC at a Flash. I'm Executive Editor Rick McGuire.